Well, today is World Mental Health Day, a day focused on raising awareness and improving access to mental health care all around the world.
Joining us this morning is Dr. Sasha Zhou, an assistant professor in the Department of Public Health and an expert in youth and college student mental health. Dr. Zhou, we appreciate your time this morning. Let's first start off with why this day is so important.
That's a great question. World Mental Health Day, I think the most important piece about it is really just raising awareness about mental health issues. It initiates conversations about kind of its salience to kind of overall well-being and also physical health. And I think kind of this global piece about it, it really feels like a call to action and advocacy, serving as a platform for health providers, for policymakers, for advocacy orgs to use this day as an opportunity to share resources and really push for more investment into kind of mental health services and resources.
Yeah, let's talk first before we get into like the personal, care issues surrounding mental health. Can you talk about the picture globally? What's the big picture?
So my work is really on young and emerging adult mental health. And so I can't give you a sense of, from an evidence-based level, the picture of the adults, the older adult side. I think from kind of from the perspective of young people, the things that I have seen is really challenging at the moment is loneliness. We live in this digital age where folks are just spending less time together. And our survey measures the survey that I work on, which is called the Healthy Mind Study. We look at kind of a national picture of young and emerging adult mental health. And our study has consistently found that, especially in the last, 3 years or so, 3 to 5 years, that loneliness is a significant issue. Over 2/3 of students to 3/4 of students report experiencing significant loneliness. And that kind of really is tied to other mental health symptoms like depression, anxiety, suicidality. So that's why we really care about this issue.
Yeah, loneliness seems to be something that's come up in conversation very recently, especially in other reporting that I've definitely seen.
Yeah, absolutely. In your research on mental health with young adults, I wanted to ask you if there's any misconceptions that you think a lot of people have that you found in your research, or if there's anything kind of surprising that you think people might need to know.
That's a great question. So, our work on healthy minds, we know that young, like college student age mental health, for a decade or so, we saw this steady increase in mental health symptoms. From I think our survey started in 2007, and since then we saw, almost a doubling of clinically significant depression as well as anxiety. But actually, in the last few years, we found that student mental health symptoms have slightly gotten better in terms of more students are reporting flourishing, slightly less, maybe like a 1 to 2% decrease in anxiety and depression. And that was happening now for kind of the third year in a row. So before we're like, is this a trend? Now we can say that something interesting is happening here. So I thought that signals perhaps a couple of things, perhaps just things are getting a little bit better since the pandemic, right? Because that was a time of significant stress. And then maybe that college and universities are actually investing a bit more into mental health support for their students. So I think that that's really interesting. Something that is kind of keeping me up at night in terms of mental health and things that I hope to look more into in the future and what I want people to know is this idea of sourcing mental health support from non-experts. So, we know young people, they love using TikTok for everything. It's not just used right now for skincare recommendations, but it's also used as sometimes a therapy tool or kind of like a mental health resource tool. And I'm really wary of that. And then you add in these kind of chat GPT, LLM, like chatbots. And that is kind of this whole other piece of sourcing mental health support from non-experts. Chat GPT is not a crisis tool. It often, we know we've seen delays actual professional help. It can reinforce negative thoughts. And then we know that some users developed emotional attachments to these chatbots. So these are kind of the things that I wish there was more awareness of, because just like some of the danger in these tools.
Yeah, absolutely. I think you raised several good points there.
Yeah.
Not only just the social media aspect side of this, but I mean, ChatGPT and things like AI are becoming normal parts of our life more and more
Yeah.
as we continue on here. So what is your recommendation when it comes to getting professional help, when it comes to getting those real life tools that can help you in your everyday mental health situation? What would you recommend? Obviously, we're here in social media and ChatGPT may not be the best things for us, but what do we need to do to maybe, I'm guessing, contact professionals and make sure that we're checking in with them?
Yeah, I think, I look at mental health from a public health perspective, which is a little bit different than the clinical side in that I think about kind of population level resources. And I think, you bring up this good point. We definitely checking in on yourself. And I tell my students all the time, it's really important to get help before stress reaches a crisis point because similar to physical health, addressing symptoms of worsening mental health is a really smart and courageous thing to do because similar to physical health, mental health issues are generally more difficult to treat the more severe your symptoms are, right? So, and then mental health is also connected to all of these other things that are important in our lives, our relationships, our jobs, our focus, energy levels, and so forth. From a public health perspective, looking outside of just the one-on-one counseling model, because we know it's important to seek professional help. Again, like from a licensed professional, not chat GPT, not, TikTok and so forth. It's important to seek professional help. But oftentimes, especially on a college campus, there's just not enough counselors for the students that they serve. And we find this to be an issue across so many institutions and also well-resourced institutions, right? Like your Ivy Leagues, institutions that tend to have more resources, but also still kind of struggle meeting the demand. So when we think about kind of a public health approach, things that have worked well from the evidence include, the supervised skill training. So, having actual interventions that are focused on mindfulness and social skills and building those skills with young people. Means restriction for suicide prevention on campus is really important. Thinking through kind of like screening and referral programs, belongingness interventions. And then we also have this in college campuses in particular, there's a growing body of research on peer support and kind of peer-to-peer interventions. So that's also been, there's some promising evidence on the outcomes related to that. And then also building mental health into the curriculum, right? Finding ways to build these social and emotional skills into the actual college curriculum. So to bring in these things that I've talked about, like some self-awareness into when you are actually experiencing some serious and significant mental health symptoms.
Interesting, where you're finding ways to plug in mental health education in places. Yeah,
absolutely. Something else I want to ask you about too is that, of course, cost, finances can factor into how our mental health is to begin with, but it might also be a concern for people that are trying to seek help for something like this. What advice would you provide to people where maybe cost is a concern when we're talking about really seeking out those professionals for mental health?
Yeah, that is a really great question. And I'm going to be honest, from as a, someone that studies college student mental health, there is a privilege in that population in that many college campuses offer counseling for free. And I do think like many college students actually don't know that. So I'm a Wayne State professor. We have a wonderful CAPS program, a counseling center embedded in our campus, and they actually offer free services for students that doesn't show up on their insurance, which that's important for some of our students because they're worried their parents might see it and there might be stigma in the household towards receiving mental health services. So for the general population, I do sympathize the use of sourcing from non-experts because it is so expensive to get professional mental health care. And I think this is why it's so important to have these days, right? We really need to think about providing these resources and how we can provide better mental health support for the overall population and not just for a small group of college students or young and emerging adults who are enrolled in higher education.
Well, Dr. Zhou, we have to leave the conversation there. This has been very helpful to kind of understand this topic, and not only that, learn about the different backgrounds that can take hold here. So thank you so much for your time. We appreciate it. Dr. Sasha Zhou with Wayne State University. Thanks for joining us.
No problem. Thank you.